Hello, everyone. I am Chris Collins, a partner in Husch Blackwell's Real Estate Development and Construction Group. Joining me today as my co-moderator will be Husch Blackwell attorney J.P. Croak. Thank you all for making time to attend today's webinar. We hope it'll be informative for you. A few housekeeping items before we begin. At the bottom of your audience console, there are multiple application icons for your use during the program today. If you have any questions during the webcast, please submit those via the Q&A question box. The plan is going to be to reserve 10 to 15 minutes at the end of today's presentation for a specific Q&A session, but we will also try to incorporate as many topic-specific questions during the presentation as we can. Overall, we will try to answer all questions that are asked today, but if a fuller answer is needed or we run out of time, we will get back to you later via email. This program has been approved for legal education hours. To report your hours, click on the CEU icon at the bottom of the screen. A certificate of attendance, including course numbers, will be emailed to you tomorrow, along with a recording of the webcast for watching and sharing. Lastly, toward the end of the program, be sure to complete our short survey. We use your feedback to plan future programs that are applicable to your business needs. That should conclude all of the housekeeping items. So we will go ahead and move on with the presentation itself. Today, we'll be having a discussion with industry experts about emerging hot button trends and topics related to the planning, building, and operating of existing and future senior living facilities in the wake of the COVID-19 pandemic. We have a tremendous group of panelists to help us with that discussion today. Joining us are Tama Duffy-Day from Gensler Group, Brent Shanholtz from Ambassador Health, and Drew Lacey from Bow River Capital. Just a little bit more on our presenters. Tama is a principal and the Global Senior Living Practice Area Leader at Gensler, a global architecture, design, and planning firm with 50 locations and more than 6,000 professionals networked across Asia, Europe, Australia, the Middle East, and the Americas. Tama believes in the power of design to impact lives and enrich communities. As a principal and senior living leader, Tama is dedicated to raising awareness of this connection between design and health. A global author, lecturer, and speaker, she focuses on the alignment of expectation, interaction, and space to create better user experiences. In the past 3 decades, she has received more than 50 awards and honors for her work and is one of the few design professionals inducted as a fellow into the American College of Healthcare Executives. She mentors students from Marymount University as well, which is where she earned her MFA in interior design. Brent is the CFO for Ambassador Health, a skilled nursing facility and home health provider with campuses in Omaha, Lincoln, and Nebraska City, Nebraska, and Sydney, Iowa. He is a member of the Reimbursement Committee of the Nebraska Nursing Facility Association, the Nebraska City Area Economic Development Corporation Board, the Alumni Advisory Board for the University of Nebraska Omaha chapter of the Pi Kappa Alpha fraternity, and treasurer for Heart Heroes Board of Directors. Brent earned an executive MBA from the University of Nebraska Omaha. Drew Lacey is the vice president of real estate for Bow River Capital. Founded in 2003, Bow River Capital is a private investment firm based in Denver, Colorado. Drew joined Bow River in September 2017. He is responsible for investment research, due diligence, financial modeling, originating, structuring, and managing real estate transactions. Prior to joining the firm, he was an assistant vice president at First National Denver, a regional bank specializing in commercial real estate. He was the lead portfolio manager on a $300 million real estate portfolio consisting of all asset classes. Drew holds an MBA and a BS in business administration with an emphasis in finance, both of which were obtained from the University of South Dakota. So that is our group of esteemed panelists. With that behind us, we'll go ahead and just launch into the presentation because I know we all have limited time today. This will be a topical discussion. So topic 1 is, do you anticipate the design of senior housing to change in the wake of COVID-19? If so, how? Tama, would you like to start us off?
Sure. Thanks, Chris. Thank you very much for having me. And, you know, I really think facility design and operational design really always progress hand in hand. And I have a couple topics worth noting. You know, I guess the first is really this need to solve for isolation. You know, physically we can repurpose large spaces for socially distanced visitors, provide more hand washing sinks, locate Wi-Fi in every room, and even consider allowing pets. And nature can also help alleviate loneliness. So designing access to nature in gardens. One developer client built these pop-up connection cottages, which were small structures built on the outside of the facility next to an existing window. So residents could still stay on the inside of the facilities, but family members were on the outside in this connection cottage. And I thought that was a really innovative pop-up solution. And then in the future, they're really thinking of repurposing these cottages as artist studios. I also think this pandemic is really spurring, product invention. And since my background is both in healthcare design as well as senior living, I've been thinking about intensive care units and how they've been designed for newborns. We have incubators that keep the babies healthy and isolated, but these incubators are always designed with like these built-in hand elements so that caregivers and family members could touch the newborn. And babies thrive from medicine, but as you all know, we thrive from human touch. And I loved at the early stages of the pandemics where people were being really creative and they had shower curtains that they strung up and, cut out holes and duct taped in gloves so that, family members could come and get hugs. So I really think, we can invent products like this and provide these products like PPEs for older adults. Another topic is really about cleanliness and airflow. We know we need operable windows, single occupancy rooms, if at all possible, the concept and investigation on air filtration and air changes, really maintaining mechanical systems, the addition of touchless door operations, increased cleaning protocols. I really think all of these interventions will really be consistent moving forward. And, they all go hand in hand with operational strategies. Similar but yet different, my brother-in-law, who has cerebral palsy, lives in a group home. And although caregivers normally rotate shifts for 24 hours, the caregivers have been on site for 2 weeks at a time. And maybe my last comment is really about caring for caregivers. As we've seen through the pandemic, caregivers are given so much of themselves to care for and keep others safe and healthy. And we must continue to find ways to give back to them and recognize all of their tremendous efforts. And caregivers also need caring, and design needs to provide spaces for their well-being. So break areas with views, and some facilities are designing resilience rooms where staff can actually step away in an offstage moment and decompress for 10 or 15 minutes. With the shortage of caregiving staff, retaining and recruiting staff will always continue to be a really important part of designing experiences for residents, visitors, and staff to truly make your culture visible.
Thank you, Tammy. Those are some great comments, and really the solving for isolation. I think that strikes everyone, because no matter who you are, you've probably felt that over the course of this pandemic, and how much more in the senior housing industry. So thank you for that. Drew, I know you have some comments on this topic as well. You want to provide those to us?
Sure. Thanks, Chris. Yeah, and I would echo what Tama was saying. And really, I think there were a lot of trends that started pre-pandemic that were just forced to move faster. A couple of those independent living cottages have been becoming higher demand for quite a while now. We have them at a few of our facilities. And what we've seen through the pandemic is individuals want to live in a community where they have access to all these amenities, be it the food service, just be it the care. And by having these independent living cottages available, you still have separate entrances, you still have your own space. This allows these people to move into a facility, but maybe take away the concern of family members of not being exposed in more of a larger group setting. So I think that's a trend that had started previously, but it's really progressed much faster. The other things, simple things such as air filtration systems. Again, this is something that we were looking at in facilities pre-pandemic, but now it's that much more important due to COVID today, but also future illnesses that may come around. We just want to make sure that the air filtration systems, when we're designing a building, are adequate to protect the residents. And, another big piece I'd say is designated visitation and designated really visitation virtually for our residents. What we've seen through this time is visitation, isolation has been a big issue. We want to be able to allow our residents to visit with their family members, their friends, and not have makeshift rooms that are just set up when it's needed. We want residents to have access to a room where, be it Skype or any other type of technology, they are able to go in there at any point in time, visit with family members, as if they were there personally. And then the other piece I'd say on visitation too is going to be, we have some facilities today where we're using the administrative conference room. That's the main visitation area, because we did not have a designated area where family members could come in and visit with family, the resident, but still be socially distanced. So looking at that going forward, not just during a pandemic as we're in today, but having a designated area outside of the family member maybe coming back to the room. This can be towards the front, so exposing other residents to potential illnesses, and they can still socially distance. The last piece I'd say, and this is a trend that really it comes and goes, is the size of rooms. I know isolation is always an issue, and we don't want residents staying in their rooms at all time, but we've seen this cycle kind of go up and down where the demand was for smaller rooms, just maybe due to access, kind of the price point. Now we, even pre-pandemic, we were seeing that residents want a bigger room. They are downsizing, but studios probably aren't the right fit for them. They need a larger area for a time like this, that if they do need to be isolated, they have space where they can still feel like it's a home to them.
Thank you. On a somewhat related topic, on the development side of what you do, have you noticed any delays, or actually maybe even the opposite, in terms of construction projects or development projects that you all have?
Yeah, and some aren't even specific just to senior housing. We invest in really every asset class out there, and there are delays. There are construction delays just due to some of our construction workers going down for a period of time. So there might be a delay on the job site. So that's been a big piece, but we've seen that in senior housing. We've seen that in industrial, office, kind of all across the board. The one thing specific to construction delays or just delays in delivering a new senior housing facility has been health agencies not having the bandwidth to come out and inspect and really approve us for our license. So we've seen that in a few different states where, again, just due to individuals working from home, not wanting to go out to job sites, be exposed to individuals, where getting CO and then getting our license is being delayed, sometimes up to a few months, just because there were a pipeline of quite a few facilities being delivered in these areas. And it's pushed out, when we expect to actually be able to move in our residents.
That makes sense. If there's anything else, or if there's not anything else, we'll move on to topic 2, keep the ball rolling here. Second topic is, what have you seen done / what are you doing at your facilities regarding retrofitting them to deal with COVID-19 precautions? And do you believe they are permanent changes? Brent, do you want to get us rolling on this topic?
Sure. Thanks, Chris. I think both Tama and Drew touched on a few challenges or a few changes that have maybe already been coming, and this pandemic has maybe accelerated those and emphasized some of the importance. But in terms of retrofitting a skilled nursing facility or making some changes, I think a key area to look at is the materials that you're using in your spaces, whether that's flooring, wall coverings, things of that nature, and again, the technology that's available in the room for your patients, making sure that you've got access to FaceTime or outside communications at all times is very critical. We're a much more virtual world, and this pandemic certainly emphasized that. Reconfiguring space in your skilled nursing facility is also going to be important. What do you have for communal space so that people can spread out and still interact in person? That has much more of a focus. If you've got facilities that are still using multiple occupants to a room, it's very important to move away to that, get to private suites, and have plans for visitation have that that ability to provide human interaction with the family and the support, and do not only the telehealth and utilizing the technology, but having your space set up so that you can do that effectively. That's certainly something that families and patients are going to be looking for as they choose their healthcare providers.
And Brent, what would you say you've detected as kind of the permanency, or is still just a lot in the air as COVID-19 is a lot in the air in terms of the efficacy of the vaccines and things of that nature? What are you looking at in terms of the permanency of these retrofits?
Well, in terms of permanency, I think the good news is that a lot of these changes are exactly what our customers are looking for in the long run. So making that change will make a better product offering for you. I think it's a little too early to tell the permanency exactly. We just have FDA approval, Friday evening, trying to get that vaccine deployed, seeing how effective it is. It's a very exciting time, at least in the skilled nursing facility world, but there's also a lot of unknowns. And are we looking at some of these continued precautions with PPE, with space, with our infection control heightened? Are we looking at that for 3 months, 6 months, 12 months, 2 or 3 years? I don't know that anybody has that answer right now, but there is a lot of exciting things to monitor. And I think making some of these critical changes, whether we have to do it for a long time or not, will make a better, more desirable offering out into the market that's seeking skilled nursing care.
Great. Tama, I know you have some thoughts on this. I'd love to hear those.
Sure. I agree with both panelists' conversation. And, a part of this is also about a process. So we've been working with operators and developers and providers through a process we call experience mapping to really study if these changes should remain in place and how we could map them to really truly understand it. So like an example is we have been working with Willow Valley Communities, an organization in CCRC in Lancaster, Pennsylvania. And even just last week, we took what we called our avatars or personas. We had 5 of them. And they were a visitor coming to the fitness center, a resident parking in the garage. This is an independent living facility. A frequent visitor, hot food delivery from a local restaurant, and then FedEx delivery. And we really mapped each one of these avatars' journeys through the building to determine, where public and private met, to align expectations of operations with the design. And for instance, they used to think, since this project is in design development, we used to think that they thought FedEx would come in through the front door. But when we began to map this, the literal physical space and really do research and understand, the number of packages now arriving is just astronomical. And the traffic and experience at the front door would not be what would be experienced and desired. So we have now rethought a process where the packages will come in through the loading dock, and we've increased the size of the packaging holding area significantly, and are in the process of reviewing things like various lockers that can be used for grocery delivery, dry cleaning delivery, prescription delivery, and in mapping the journey of someone coming in to use the fitness center, we're literally relocating one of the elevators in a different location so that resident population and visitor populations don't overlap. So, the process of going through this can help an operator understand perhaps what things should stay, what needs to be modified, as Brent has indicated, forever, and then things that have space in the middle. Do you want me to talk a teeny bit about robots, Chris?
Yeah. When you were discussing this, I thought that was incredibly interesting. I'd love to hear some of that.
Sure. Well, since we are a global firm, we've also been trying to learn from other countries. And since Japan has the world's oldest population, we've been really kind of watching and seeing what they've been doing for their elders, their older adults. And they've been using robots in really interesting ways. They see a real shortage of staff, of care provider staff. And so they've been looking at ways to supplement their delivery of care. Some of them are really kind of low tech, if you will, something like a companion dog or cat that's a robot that, you can have interactions with. It's kind of a glorified version of Alexa. In other places during the early stages of the pandemics, they had robots that were basically a motorized kind of big computer screen, if you will. And so the provider could, out in the hall, call the resident's family member and get them on, a type of Zoom call, and then send the robot into the resident's room so that the elder didn't have to deal with pushing buttons and understanding how to communicate. And that really helped build connection between family and residences during the early stages of the pandemic. And they see that they'll continue that. And then this third piece, it's called Reba 2. And it's in protocol development and use now, but it's a robot to assist with lifting. So a robot can help, actually, they're testing it lifting someone from a futon mattress and lifting the person from the bed to the wheelchair. So as you can imagine, there are so many staff injuries around transport and lifting residents. So at the moment, this robot can lift 180 pounds, which isn't a whole lot of weight, but even 180 pounds in an assistant manner would be significant. So we've been really seeing the invention, if you will, the forefront of the robots that we see will be coming into our industry sometime soon, if not very soon.
Thank you, Tama. Yeah, the incorporation of robots, that was an intriguing conversation. It also made me think for any Big Bang Theory enthusiasts of Sheldon when he thought his brain was too valuable to risk a car accident or a slip and fall. So he made his mobile virtual presence device. But we have a great question from one of our attendees. The margins are fairly narrow in the post-acute care world. Assuming the facility cannot self-finance, where do you think the financing will come from to retrofit/comply with new design COVID-19 issues? If any of our panelists want to jump in on that question?
I can jump in on that, Chris.
Thanks,
I think in the near term, there has been some, I'll use the word support for lack of a better term, from some of the CARES Act provider relief funds that have been specifically allocated to Medicare and Medicaid providers in the skilled nursing setting to help with some of that retrofitting, or to help with some of the ongoing precautions that we need with infection control. Certainly, every provider is going to be different, and every circumstance is going to be different. So whether those funds are sufficient or not is certainly questionable and has to be evaluated at each operational level. But that can be a good place to start. The difficult part with financing will be the projected revenue growth. If there's been census struggles, if there's been slowdowns in admissions, if there's been slowdown in discharges from hospitals, and having a good relationship with your financial institution for floating those things, if cash flow is a problem, is going to be a true challenge. I don't think there's any way around that, but getting started and seeing what the possibilities are and how you can differentiate yourself and maybe come out as a leader and as a unique provider based on some of that retrofitting may give you the edge that you need as things begin to open up and as the admission pipeline begins to get back to somewhere closer to normal.
Thank you, Brent. Drew, I know you're more assisted living, not skilled nursing facility, but do you have any thoughts on sources of funding and things of that nature?
Yeah, I mean, what we deal in is all private pay facilities. So any sources of funding, when we're retrofitting buildings, it is a concern. We do own some older buildings, and we're constantly monitoring what changes are going to be required. I think only so much can be required of changing these buildings, of layouts, different things, just because they aren't going to be able to stay open, and there's too much demand to be closing facilities that just can't hit certain requirements. But from our standpoint, again, we're not receiving any type of aid. So on 2 of the facilities we do have, banks are willing to provide some of that financing on these retrofitting requirements. But that's just an owner cost. So if it is a requirement, if there's certain things that do need to be changed, that's going to be coming directly out of owner's pocket to make those changes to stay in compliance.
Great. Thanks, guys, for jumping in on that question. Unless there's anything else, we will go ahead and jump on to our next topic, which I'll hand this off to JP.
Thanks, Chris. And I think this is a good segue here to our next topic. And I think I'm going to stay with Drew here. Drew, what trends are you seeing in the finance area for new facilities?
Yeah, so this is an interesting question. And back to my previous point, I don't think this is just specific to new developments. What we've seen really starting in March was the debt market completely shut down. So anything from, industrial, which is a hot topic and everybody is investing in industrial, we were seeing banks completely pull out, unless it was 100% pre-leased and there was really no risk whatsoever. Across really all asset classes, we've seen leverage come down. If you were underwriting 65% loan to cost before on a construction project, it's probably 55 today. With that said, I think banks are coming back into the market. Now that there is vaccine news, we just understand, COVID-19 a little bit more, and we understand how to handle it. We are seeing banks that are coming back into the market. I think what this did do is there was a lot of banks that historically did not lend in the healthcare arena that were getting into this market, and they were looking at it more as a multifamily asset on their books. And what COVID-19 did was it forced them to look at it much differently. Obviously, it's much more complex than looking at a traditional multifamily project. So, on the senior housing side, I think there aren't as many banks that we would have looked at before that are still in this market that would be competitive. Leverage is coming back a little bit, but it still is not where it was in January. When we're looking at a deal now, maybe it's 5 to 7% lower from a loan to cost standpoint on how these banks are going to look at that deal. And the last thing I think on this, I think the biggest change is banks are really scrutinizing the budgets that we're giving them much more. We could debate for a while of what future rent growth is going to look like based on what we're going through today. Banks are really being conservative, and they don't want to see much rent growth built into your pro forma that you're giving them. They really want to understand the expenses. Some developers are just strictly underwriting to an operating margin that they think they'll get to, and they're backing into what those expenses are. These banks are now closely looking at, obviously staffing requirements. You probably have to pay more overtime with staff members going out sick and bringing in other people or contracting for services. So, I think along with some, newer developers in the arena, I think banks are also along for the ride and really starting to just digging into these budgets much more, making sure they fully understand them so that they are protected once they get to a point where we are in lease up. So I'd say those are the biggest changes I've seen thus far.
And Brent, in terms of existing facility finance, I think you had some thoughts on that. Could you share that with us?
Yeah, and I think Drew said it best when you're going to be a little bit more scrutinized on your financial statements and on your cost. And the simple fact is, in a pandemic environment, everything is more expensive, and it seems like everything takes more time and takes more consideration, and everything, at least in the skilled nursing setting, continues to be regulated for safety and compliance on under a pretty intense microscope. So if you are putting pro formas and projections together, or if you're doing your annual meetings or quarterly discussions with your financial partners, having true and reasonable projections that aren't based on the past 3 years, but more so based on the past 3 months, and then the upcoming 6 months. It's a shorter look, and it's definitely something that just takes a little bit more detail, a little more focus, and a little more adjustment. I think of the cost that you're seeing for PPE. At some point, that will stabilize. At some point, we'll have more of a, this is the amount that you need to have on hand, and this is how much it will cost. But with items like labor, you don't have enough care staff out there to meet all of the needs that you have. We're all working very hard to compete for the same market of caregivers, whether that's RNs, LPNs, certified nursing assistants, and they cost a little bit more than, say, they did a year ago or 2 years ago. And that cost isn't going to go away in the future. We're just not all of a sudden going to say, oh, okay, yeah, move my hourly wage back to where it was. That's fine with me. That's an expense that's going to stick around. And I think what's important as an operator is that you're also making considerations for what your revenue sources are. If you have a lot of private pay, how is that messaging getting passed on to those customers? If you're taking a lot of insurance, Medicare, managed Medicare plans, or even participating with a lot of Medicaid, where does that rate come in at? What type of adjustments or what type of shortfalls do you have in the future? And knowing that, understanding that margin, I think Drew discussed that, you're going to have a more narrow margin, and there's going to be more expenses that have to be covered, and that's going to stick around for a little while. So being clear and transparent about that with your financial partners, if you need to inject some cash or just continue to maintain that relationship, I think showing that you know what's going on, you're looking at multiple scenarios, multiple things that can happen in the future, and what you're doing to prepare for that will be most critical in maintaining those relationships and maintaining your financing.
Interesting. So either Brent or Drew, we're talking about financing new facilities and existing facilities. In terms of what you're seeing in your regions in terms of deal tempo, can you give us some insight into what you're seeing either in your own organizations or with your competitors? Drew, do you want to?
Yeah, Brent, if you don't mind, I can jump in first. Sure. So, I mean, as goes the debt market, as goes deal tempo. As I said before, the debt market isn't what it was before. Financing is, from a leverage standpoint, is not what it was before. And, depending on what the investors' return expectations are, it just might not work anymore. So what we have seen, we kind of cover Rocky Mountain West down into the Southwest as the main regions that we cover. And, any of these developments that we're working on, we're partnering with a local developer market as well as an operator. And what we've seen is there was a lot of deals January, February that we were looking at that went away completely. Some of those were just delayed. Some were just pushed back 6 months to a year, wanting to fully understand what the landscape is on the other side. But a big piece of that was due to the debt market just not being there. They could not get the financing at what they were currently underwriting. So we have seen a fall off in deals in the new construction side. However, it's picking back up. I think 2021 is going to be a big year of new construction starts in this space. A lot of the deals that were on the table for this year, again, were pushed off. And, I can rattle off 7 or 10 of them that we were looking at that now we're just projected to break ground in June of 2021. So I think you are going to see an onslaught of new developments breaking ground next year.
And Brent, in terms of SNFs, skilled nursing facilities, and existing inventory, are you seeing any trends that might be interesting in your area in terms of trades?
It's an interesting question, and I think the timing of this discussion and the timing of some recent announcements and things at the federal level all play into that. We, again, have the news of the vaccine, and we're planning for that. Financing is a little more tricky right now, and I think a lot of operators in the SNF setting in terms of their own resources and their own capital are probably cautious and waiting to see. Each day you're not sure exactly what you're going to need in terms of PPE or bringing in staff or bringing in agency to fill some different areas. Some of those ongoing costs, some of those safety requirements, you don't quite know. And 1 or 2 positive COVID cases in your building could change your outlook and your planning significantly over the course of 24, 48 hours. Knowing that, I think there's a lot of caution and probably not a ton of activity, but at the end of this pandemic, I guess, assuming there's an end to the pandemic or some sort of normalization there may be some providers that are in a very good position to really start going out and evaluating the market, maybe some acquisitions and some growth of organizations or some consolidation. So I think at this point it's a little too early to make a whole lot of projections on that. I think we're all very closely evaluating more of a day-by-day basis and trying to focus on vaccinations and safety and staying as ahead of the curve as we can and looking to the future.
Tam, are you seeing any trends in your with your clients in terms of you talk about these design elements that are becoming more and more important, and these all cost money. So I would imagine with the people you're working with, the organizations you're working with, that's becoming a squeeze. Can you kind of comment on that?
Sure. I actually was thinking of a couple things. We have operators that are looking to hotel operators to see if existing built buildings could be flipped, if you will, to provide more care for the need of older adults in senior living capacity. So we have been, looking at the layout of the hotel spaces, the rooms, the corridors, to seeing what minimal intervention could be done to some of this built property to help alleviate the need and the growth. And that could obviously be done less expensive than building from start. And, because our design thinking strategy of our firm incorporates designers from all different practice areas, there's been a real interest in our process of design in terms of analyzing how to look at what is being built and the strategies of its being built. So, we just generally bring in experts from a variety of areas, so hospitality, residential design, wellness, healthcare, into designing for senior living. And that can result in some outcomes of a slightly different strategy for the built environment, and in some respects could save some dollars in constructability.
Interesting. So as we kind of talk about these changes to facility design, the finance aspects, and I think maybe we'll stay with Tama, but we can maybe get everyone else's opinion on this. Do you view as some of these kind of triage adjustments that facilities are needing to make in response to COVID, as these get baked in more to future design and kind of expectations of your clients in terms of services available? Are there particular design elements, services, amenities that you view as being potentially aspects that can distinguish you in the market or distinguish your clients in the market in terms of fielding residents? Yes,
most definitely. Each facility has its own culture and has its own strategy of the type of residents that they are marketing, if you will. And, we see a variety of things, anything from like building design that just integrates nature and gardens in a more, inclusive way. So, I mentioned operable windows, but balconies if it's a multi-level facility, so that this access and natural air and ventilation can flow through the buildings. I think even though that may not be seen as an amenity, It is in many cases if you're building in an urban setting, and access to nature is a really critical piece. Other elements are, the obvious ones like in-room dining with menu variety. We've already talked about telehealth and telemedicine, but having smaller clinics in buildings regardless of their size. The increase of both physical activities and social activities through virtual learning. We see that that is an amenity. Wi-Fi throughout the facility in every single room. And, rethinking the operational strategy of whether you can have pets or not. I guess I'm looking at, in terms of competition, in some respects, we see the real competition in the market is people staying in their homes. So as healthcare becomes more and more accessible in your home, and for those highly functional older adults, how will you bring them into your community? How can you design an experience more compelling than their existing home and their existing community? So looking at ways that you can extend a healthy life through these elements of health and wellness and well-being that you can design into not only the social aspect, but the physical aspect of your buildings.
Brent, do you see some of these new services, amenities, and design characteristics as being important for future kind of competitive distinction for your facilities?
I do, and I think I guess if I were to look at that in three aspects, no matter what, as we go forward, I think the customer and the family from a skilled nursing, from a long-term care setting, they're interested in safety for themselves, for their loved one, and they're interested in access, to spend time, interact, and be available in whatever form that is during their stay in a skilled nursing facility or a long-term care facility. So that's not really changing, and anything that you can do to emphasize that you can achieve that safety and achieve that access is important. And a lot of the items that Tama talked about are enhancing that experience and making that experience better, even better than it was prior to the pandemic. So that doesn't go away, and that's a great thing for your operation. And I think another aspect to look at is your acute care partners, your hospitals, and of course the payer sources that you're utilizing for your admissions that are coming into your skilled nursing setting. They're most interested in your outcomes and your compliance. And if you're not doing the things to keep your patients safe and to provide dignified care with access to the family, there's a good chance you're not going to have the desired outcomes that you and your patients are looking for. And you may run into some compliance issues with your federal and state survey boards. So again, I think some of those changes are making you a stronger, more robust partner for those that are relying on you, again, whether that's the insurance company, Medicare, Medicaid, or the hospital that's trusting you with their patient discharges. And lastly, your community that you're serving, whether you're a skilled nursing or an assisted living facility in a rural community or in an urban setting, that community wants you to be open. They want you to be taking care of their most vulnerable population. And quite frankly, they want you to be employing people and keeping people working and having a place that's this desirable for our valued healthcare workers to go every day and take care of patients and produce outcomes. So I don't see a lot of the changes in the long run not being a positive impact for your operation. I think a lot of them are good things, and they stay integrated in our industry for quite some time.
Drew, do you have any thoughts on this particular issue of additional services, amenities, design elements that you think may be kind of advantageous to your group?
Yeah, I would echo what Tama was saying. Our biggest competitor is, our residents' homes, staying at home or staying in a family's home. So, just making sure the facility, is as close to home as possible through some of the things we previously talked about, access to family members, if it's during a kind of lockdown like we're in at certain times, making sure they still do have access via the technology to be visiting with family members as if they were at home. I think that's a big piece. The social aspect is key. That's what we're selling our residents. Obviously, the healthcare aspect in assisted living is huge, but the social aspect is just as big. That's what keeps these people going, having people of similar ages. So just making sure you do have the social settings available. And, not specific to this is because of the pandemic, but, again, we're not an operator. We're strictly a private equity group that's partnering with operators, partnering with developers to build such facilities and operate them. But, what we've found through this pandemic is partnering with the right operator makes a world of difference. We've recently consolidated operations with one of our local operators here. And what we've seen just via the knowledge, how good the staff is with residents, just how attentive they are, communications with family, it's made the world of difference. It's made us feel much better about these investments. But also our residents, we hear it from them directly of having the right operator makes a world of difference. It can make or break a facility. Not only obviously healthcare is first and foremost, but having the right people, the right knowledge, it goes a long way with these. So I think that really sets the community apart. The amenities, yes, but I think this time there's been a consolidation of operators. Some of the smaller ones, have been bought up or just are not around anymore. And not saying the big operators are the best, but having a group that, can scale with you, but has the resources in-house to really do the job right.
So it sounds to me everyone agrees that notwithstanding the changes that are happening in the market, the fundamentals of operating these facilities are still kind of core to their success. So as Chris mentioned earlier, we are reserving the last 15 minutes or so of the program for Q&A. I haven't seen questions yet, but if the attendees do wish to ask specific questions of our panel, now is the time. Seeing none thus far. Perhaps because, Drew, you are involved in primarily new facility development, could you give us your thoughts on Tama's comments relating to the conversion of existing structures such as hotels into senior care facilities?
Sure. Yeah, and we've seen this a number of times. This has been going on before, but it's just due to construction costs where they're at, it's definitely progressing quicker. So we've looked at these opportunities. We've never done them ourselves, but there are a lot of hotels that are set up. They have kitchenettes in place today. All the infrastructure is there, so you can make minor modifications to make these operable as a senior housing community. One thing I guess I would say, back to your point previously on deal flow, what we have seen really over the last 6 months, which is new to us, is newer communities that are in lease up hitting the market that we've never seen before. These are brand new communities designed right in the right areas. And I think, us being a private equity group focusing on new development as well as buying existing communities where we think we can add value, we're seeing a lot of communities that maybe it just wasn't the right group that was in there initially. And they aren't willing to wait for this lease up. They're trying to, shed the risk just due to the headlines every day of senior housing. So these types of communities are popping up all over the place. We've looked at quite a few down in Arizona that 50 to 75% leased, and they don't want to stay on for this anymore. They don't know what the landscape's going to be in 2021. And this provides us an opportunity to come in. Maybe there are some design element changes that we can do. Such as my previous point about increasing sizes of rooms. Maybe the unit mix wasn't correct of too many studios, so we're making more one bedrooms just because that is what the demand is. People want bigger areas to live in. So again, the hotels, we have seen quite a bit of it. I'm not as familiar just because we haven't done it ourselves, but we are seeing more deal flow from newer existing opportunities.
And to Brent, I think we had some discussion around what blind spots perhaps this COVID experience, the pandemic, has revealed to operators. Could you comment on or give us your thoughts on any blind spots that have been revealed through this experience from your perspective?
Yeah, I think that's a good question. I think one that comes to mind right away is, I think if you weren't already aware of the supply chain for medical equipment or personal protective equipment, I think you got a quick dose of that and immediately learned a lot about who your vendors are, who your partners are, and what type of communication, guidance, and support they gave you through some of the early processes. I kind of liken it to out in the community, we learned real quick how much toilet paper is available out there. We probably learned some of the same things about medical equipment and skilled nursing, facility supplies. And I think the other thing we learned is how quickly having multiple staff members out for an extended period of time, say 14 days for a quarantine, how impactful that is, not only on your staffing levels, but on your team members that are responsible for scheduling, staffing, filling, meeting those needs, coordinating all the care that you have to do on a daily basis, things like, baths, activities, serving meals. It's one thing when you have somebody call in for a day, as they're not feeling well. It's another thing when you have staff out for a couple weeks in a row, and understanding that you really have to prepare and really have to have some contingency plans in place and have some really good relationships with maybe your other buildings that you operate with agencies, with things of that nature, to make sure that you don't dip to a level where you're really straining your staff or really straining your patients. I think those are a couple areas that we definitely had to look at very quickly as an industry and respond to very quickly.
And I think same question to Tama. Are there blind spots that you've seen for your clients that have been revealed through this pandemic?
Brent certainly commented on a lot of them. I guess I would add that it is certainly revealed the lack of equity in not only senior living, but access to healthcare and COVID testing. And I hosted an interesting podcast with two gerontologists, Esther Greenhouse and Bill Thomas, and with Stephanie Firestone from AARP. And they have a whole series called Equity by Design. And I'm happy to put in the chat room access to that podcast, access to the AARP content on that. But it was really about how to address historic inequities that have led, to disproportionate struggles in terms of just basic, safe, healthy, and well-being. And that certainly has become front and center during the pandemic.
Drew, any thoughts on this area?
I really would just echo what the existing panelists have said.
Okay. Well, we do have a question coming in from one of our attendees that maybe, Drew, you can field. In terms of resources for contractors that may be looking to expand their business into this area, developing or building for developers and operators, what resources are out there for them to learn more about the specific requirements for contractors?
Yeah, I mean, our experience, we work with contractors, of all sizes. What I've found, I'm not a contractor, so I can't speak directly to the resources, but what I've found is, a lot of the multifamily traditional apartment builders, contractors we've used in the past have transitioned in this being a big part of their business. Not only is senior housing the new supply coming online each year is significant, but when you look over the next 10 years, it's going to be, that much more drastic. A lot of maybe the dated product, especially on the private pay side, is going to be probably transitioned out at some point. And this newer product will be a key piece. So again, I can't speak directly to the resource, but just from dealing with the contractors we do, our contractors are not strictly building senior housing. They're usually traditional multifamily builders that are transitioning into this being a key piece of their business.
Thanks for that insight. Let's see. We do have a few questions flowing in here now. I think, Brent, this may be appropriately posed to you. Are you seeing any impact on inspections, how HJs are performing inspections during COVID, and how is that impacting your operations, if at all?
Sure, that's a great question. I don't know that I can speak to that at a national level, but certainly had some exposure to that in Nebraska and Iowa, and our state team that surveys nursing homes and kind of helps keep that compliance and that safety going. They've certainly been stretched and running all over the place and trying to make sure that they're responding to outbreaks, making sure that infection control procedures are being followed, and having to use a lot of judgment between, what's bad, what's really bad, what's okay. It's been quite a process, and there's been a lot of activity in terms of survey tags and civil monetary penalties being initially levied. I'm sure there's going to be lots of review and lots of time to go through those things, but it's certainly heightened. And if you have gaping areas where you're not being compliant or where you have some serious safety issues, they are going to get reviewed, they're going to get tagged, and you have to make some changes and some adjustments very quickly. So definitely some more activity and a lot more risk to the operator. And it's certainly, I think it ties back well to our discussion of a lot of these changes and a lot of these adjustments that we're making in a pandemic world. They're necessary, and we need to be as safe as we can. And making some of those adjustments will make us stronger as an industry in the future.
Drew, are you hearing from your operators any issues relating to changes in practice from AHJs, inspections, those sorts of matters?
I am not. I just see that one of our operators is actually on this meeting, so he would be able to speak to it much better than I could.
Give us his name. We'll have him on next time.
All right. Shout out Dave Moskowitz.
Chris, do you have any final thoughts here as we kind of wind this session down?
No. I mean, obviously, thank you to our panelists for giving their time, not only preparing for today, but then presenting. I think a lot of these issues have, like we were saying earlier, with addressing, I guess, for lack of a better term, the loneliness that has come with this pandemic. There's so many aspects of this that are felt by everyone, and it's interesting to see these perspectives in this niche of the construction and operating and design industry. So, thank you again, and thank you, JP, for your work, and thank you for all our attendees for viewing.
Okay, I would like to reiterate what Chris's sentiments. I want to thank the panelists. It's, I think, been an excellent discussion and hopefully worth everyone's time. As we are approaching the end of the hour, I think I just have a couple housekeeping messages. Again, thank you for joining us. We hope this information was helpful to you and your organization. As a reminder, this program has been approved for legal education hours. So to report your hours, click the CEU icon at the bottom of the screen. A certificate of attendance, including course numbers, will be emailed to you tomorrow, along with a recording of the webcast for watching and sharing. Be sure to complete our short survey. It's helpful for us to get feedback from the attendees. We use your feedback to plan future programs that are applicable to your business needs. And this concludes our webinar. Thank you.